Hello, welcome. My name is Austin Campbell, and this will be my week 15 video project on the disease we've chosen. And here's my paper that I've reused for this month instead of the last one found on my desk, proving that's me. So the disease I chose for this project is type 1 diabetes mellitus. So, definition of type 1 diabetes mellitus. It's also called insulin-dependent diabetes or childhood-onset diabetes, and it's a chronic condition in which the pancreas produces little to no insulin, and as we know by now, insulin is a hormone required for glucose uptake, storage, and so when the body cannot produce insulin, it cannot break down the glucose, and someone with type 1 diabetes would struggle to use that glucose then for energy storage. And this can lead to a number of problems, complications, that I'll get into a little bit more down the line. So the classification of the disease, like I said, it is a chronic disease, and it is commonly classified as a autoimmune disorder. Even though it's classified as an autoimmune disorder, and there could be some genetic, possibly viral factors, what you'll find out between this slide and the next slide is that there is actually no specific known cause for the development of type 1 diabetes. That brings us to the etiology. So like I said, there's actually no known specific cause, even though it's kind of labeled as an autoimmune disorder. So diving a little bit more into that, they have found a few genes or a couple gene variants that put someone more at risk for developing the disease, whether that has to do with protein recognition in the body, I believe one of the genes was, so that the body doesn't recognize some of its own proteins as its own and will then attack those. Genes that kind of code for those things can affect the onset of type 1 diabetes. There's also viral factors. The disease could be triggered virally. In some cases, they found that, but again, it's generally classified as an autoimmune disorder, and that's what causes it, the body attacking the own beta cells that produce the insulin. And then there's just no insulin produced by the end. As far as a syndrome goes that this disease falls into, I couldn't find a syndrome that includes type 1 diabetes. I could find a lot that included type 2 diabetes in some cases, but with type 1, I think part of it might have to do with that there's no known cause that's been pinned down. Perhaps if a direct cause was found, then they could pair it with some other things or find some links and label it as part of some syndromes. But that wasn't the case for what I found. So that brings us to the clinical manifestations. With type 1 diabetes, it can take a while for the beta cells to be destroyed and for the symptoms to develop. Some of the symptoms can include increased thirst, frequent urination. One that I found with that is perhaps if your child is not wetting the bed and then starts to wet the bed, that could be a symptom or a indicator of this disease being developed. Extreme hunger, unintended weight loss, irritability, other mood changes, fatigue, weakness, blurred vision. Those are the most common symptoms, and if someone was exhibiting all these, you'd probably be able to point towards this as a possible disease cause. Diagnostic testing for diabetes, mostly a simple blood test is done to diagnose type 1 diabetes. The most common blood test is an A1C test, which measures your blood sugar level over the past couple of months. And an A1C of 6.5% or higher indicates that you have diabetes. There is a normal threshold and a pre-diabetic threshold where if you get your blood tested, you could be found to be pre-diabetic, and they'll say, something could be developing. That's usually with type 2. Type 1, I feel like you wouldn't really be on the lookout until the symptoms start to develop, and then you would find, okay, A1C is over 6.5%. type 1 diabetes, could be the cause here. Another test would be a fasting glucose test, which measures your blood glucose after an overnight fast to determine if your body was able to produce insulin to lower that blood glucose. If it was not able to do so, your blood sugar level would be over 126 milligrams per deciliter, and that would be indicative that you have diabetes. There's also a glucose tolerance test, which is done after a meal to see how quickly or how long it takes for the glucose to lower and for the insulin to act. And if it took too long and your blood sugar levels remained high, then that would also be indicative of diabetes. All those can tell us if we have diabetes, but then you need to get into type 1 versus type 2, and that's where differential diagnosis tests come in. So the first being autoantibody diagnosis test. Autoantibodies in the blood indicate that the body is producing these autoantibodies to fight itself. And that would be indicative of type 1 versus type 2 diabetes. Because, as I mentioned, it's an autoimmune disease, or classified as an autoimmune disease. The other would be a ketone test. So if your blood ketones were high, and you were found to have diabetes, ketones would be present in the blood if the body was using fats and possibly proteins to get its energy versus glucose. Because with type 2 diabetes, some glucose can be broken down. Insulin just loses its effectiveness. In type 1, insulin is almost not present. And so it would be very difficult without it to get any glucose metabolism. So that would help you tell or differentiate that you have type 1 versus type 2, those two tests. That brings us to some of the complications. So there is no known cure for type 1 diabetes, but it is a disease that is manageable. People who have the disease have to take insulin every day, sometimes multiple times a day, so they can keep their blood glucose levels in check. I had a friend with this disease, and constantly every meal, pre-meal, post-meal, he was checking his glucose levels, and you have to monitor and manage that throughout the day. If you don't do so, then that could lead to complications, whether it's your blood glucose levels get out of control, being too high or too low. Some of these complications can arise: hyperglycemia, elevated blood sugar, hypoglycemia, low blood sugar, foot ulcers, diabetic foot, neuropathy, nerve damage, high blood pressure, kidney disease can develop, and of course gum disease as well. That concludes my presentation on type 1 diabetes. Again, autoimmune disease, no known cure, manageable. If not managed, things can get out of control. And its symptoms can be quite severe, so it's important to catch it before it is let out of control. It's been a pleasure researching this. I look forward to finishing the week 16 stuff and taking the final.